Well, the stitches are healing nicely. There's no sign of infection.
Whoa. Sorry. Just need her for a tiny moment. Small favor. Pills.
Who's the wit?
Doctor, don't worry. I'll be firing him soon. Wait in my office.
Incision looks just big enough for a chest tube. Collapsed lung? Someone mistake you for pinata?
Delightful. Usually we just get the elf jokes this time of year.
No on trauma. Negative PPD. What flavored dwarfs are you guys?
My daughter and I both have cartilage hair hypoplasia. Think you can make a pun out of that?
Yes, but I don't want to be insensitive. She's got a bit of a short fuse, isn't she?
It's a bleb. Wait in my office.
Bleb's not a diagnosis. It's innovation.
We'll schedule an MRI to make sure. But a certain number of these cases are idiopathic.
Let me translate that into Tolkien for you guys. It means Dr. Cuddy's got no idea why your daughter's lung suddenly popped like a balloon.
You think you do?
Give me her chart and my pills.
Helium is a radioactive isotope. It travels through your veins, allowing us to see any bright spots that might indicate infection.
I'm 4'1". That's 1.5 canes in metric.
You don't look a day over 4 feet. I saw in the file that her dad was normal sized.
It's average sized.
Compared to you, I'm sure it was huge. So did he have a fetish, or did he just fall in love with your long-legged soul?
He grew up in the circus. Said I reminded him of home. Seems like you're the one with the fetish.
I'm certainly curious about the logistics. You stand on a table.
House.
Pretty much he lay flat and spin me.
Mom.
So, Abigail, you want to hop up on the table for me?
That's gonna be tough.
Oh, I'm sorry. Let me give you a boost.
Stop treating her like she's 5. Just bring over a stool and let her climb up herself.
Mom, it's okay.
I'm just trying to be helpful.
She also hates Jews.
I've dealt with worse. Being different, you get used to people's idiocy. Still beats the hell out of actually being an idiot. What?
Care to go for a spin?
This is wrong.
Cutting house off? Might not work, but it's not wrong.
Don't windows look clean?
Abigail, we need you to hold still, okay?
Can I come out?
Just hang in there 2 more minutes and we'll be done.
Okay.
Because it's effective doesn't make it right.
Cuddy's bending the rules to get a patient to do the right thing. Who'd work for a doctor like that?
And the ends justify the means?
The ends involve us keeping our jobs, sure. Lung parenchyma is clean. No masses. It's not lung cancer.
Abigail, you okay?
Because of your daughter's dwarfism, we've had to pick a higher entry point for the lumbar puncture, which increases the risk.
So why not do the lupus test first?
In the interest of time, we think it's best to proceed on both fronts.
You have no idea what's wrong with my daughter.
We have several theories.
What does Dr. House think?
He had to go home sick.
My daughter may be dying and he's gone home with the sniffles?
Well, he's not.
He was the only one who seemed to have any idea what was wrong with her. He better be really damn sick.
He is.
Nice bear.
It's a dog.
House. It's not stills. Steroids helped until the patient started bleeding from the ears and mouth.
It's a bear.
His name is Bill. He's a dog.
You win. You can have Vicodin.
Words have set meanings for a reason. If you see an animal like Bill and you try to play fetch, Bill's gonna eat you because Bill's a bear.
Are you on something? You got your hands on pain meds.
Bill has fur, 4 legs, and a collar. He's a dog.
It's between cancer and autoimmune.
See, that's what we call a faulty syllogism. Just because you call Bill a dog doesn't mean that he is a dog. We gotta x-ray our patient's leg.
Her leg looks fine.
Weird, huh?
Why aren't you detoxing?
Willpower.
What?
Normal is not normal if you're not normal.
Did you just take a pill?
No. So how does a dwarf have completely normal growth plates?
It's impossible. We must be missing something.
How many pills have you taken?
Not nearly as many as I'm gonna take. I've forgotten how delicious they were.
I didn't give them to him.
Can we forget my vices, get back to my virtues? We were missing the fact that just because we called her a dwarf doesn't mean she is a dwarf. Everyone assumed she was because of her mother. There's no test for CHH dwarfism, so she lost an identity, but we gained a symptom.
If she doesn't have skeletal dwarfism, then her short stature must be caused by growth hormone deficiency.
And something's wrong with her pituitary gland, and based on her size, it's been wrong for a while.
So what connects a long-term pituitary issue with problems in the lungs, liver, and pancreas?
Oh, you guys and your bickering. Cancer versus autoimmune.
Obviously, you think it's something else.
Nope, I think it's both. Langerhans cell histiocytosis, also known as, you got your cancer in my autoimmune disease. The immune component responded to the stills treatment, led to the short-term improvement. The cancer portion didn't.
We dismissed this earlier because there were no neurological symptoms.
Yeah, it's not your fault. The only neurological symptom was her height. Who could have noticed? This is your pituitary gland. This is the granuloma that's been crushing it. No pituitary equals no growth hormone equals not that much.
She's not a dwarf.
Just hormonally challenged.
What about my mom?
Your mom's the real deal. You're just a tiny little poser. Your recent ear infections caused your body to release a cascade of the same cells that made the granuloma. It attacked your lungs, moved down to your liver, then hitched it right over to your pancreas. We can nuke them with a mild course of chemo and then remove the granuloma.
And then what? What will happen to her then?
Let me see if I can make this clear. This pill represents a pill, and my mouth represents your daughter's mouth. We deposit the pill in the mouth. You may never be tall enough to play in the WNBA. You should be able to post up your mom, no problem.
What if I don't take the pills? What if you remove the thing in my head and give me the chemo, but not the pills? Would I still get better?
Your body needs growth hormone for lots of things, like to grow.
I like who I am now.
Nobody your age likes who they are now.
I do.
You like needing help when you want something off a high shelf? Not being able to press an elevator button above the 8th floor, having to smell ass every time you stand in line? You don't need growth hormone. It's just your ticket out of the freak show.
Can't you deliver a diagnosis without making her feel that her life isn't worth living?
Trying to help her.
You're trying to make her taller.
Not too tall. Just tall enough to wipe her own butt.
Are you high?
Higher than you.
If my daughter doesn't want to choose the easy path, I won't force her to.
Then you're a lousy mom. You want your daughter to be a freak.
We're not freaks.
You want her to overcome adversity.
Yes.
Then why stop at height? Poke a stick in her eye. Imagine how interesting she'll be then.
Being little is not the same.
You and I have found out that being normal sucks. Because we're freaks. The advantage of being a freak is it makes you stronger. How strong do you really want her to have to be? You told her what you had to tell her. Now you tell her you lied. Even if you didn't.
This is who you were supposed to be.
You hate normal.
It's not that simple.
If I grow, I'll fade into the background. I'll be boring.
We'll get you a funny hat. You could never be boring.
You want me to be like everybody else?
I want you to have what I can't.